The broadcast is now starting. All attendees are in listen-only mode.
Hi, good afternoon, everyone. Today is Wednesday, November the 2nd. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the Maryland Community of Practice for Supporting Families webinar series. Our webinar today is DDA's new Quality Improvement Organization, Liberty Healthcare. That's our QIO. This session is being facilitated by Marianne Kane-Bresci, Parent and Director of Family Supports for DDA. Her special guests include Jennifer Metrick, who is the Executive Director of the Quality Improvement Organization, and Nicole Kropfelder, Director of Quality Enhancement with the DDA, as her guests. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options for listening to the webinar, by computer and phone. If you have trouble hearing, you can try switching by clicking on the appropriate button on the audio section of the webinar panel. There are handouts for this webinar. We have one, and you can find them in the handout section in the panel to the right of your screen. They can also be emailed if you are listening by phone. We are recording the webinar, and we'll post that on the DDA website. We'd like to hear from you to get feedback on today's presentation and any suggestions you might have for future topics. Please use the question or chat box to the right of the webinar panel to provide that. If you have questions related to your family's members' services, please contact your local regional office. There is one last thing before we move on. We are going to ask you to participate in two polls right now and a couple more later. So give me a second, and then it'll pop up on your screen. And it takes me a while to select that. Give me just a second. Okay, first poll. Where do you live? So we have, I think, 4 responses. It's basically by region, and the counties are spelled out. We've had about half of the people have voted. If we can get a few more, I'll hold it open for maybe 10 more seconds. Okay. Okay, we're going to close it. And let's see where people live. Okay, 25% live in the central region, 29% live in eastern, 32% live in southern, and 14% live in western.
Great.
So thank you for that. We're going to do one more. What is your relationship to disability? We have 5 choices here. Looks like about half of you have voted. I'll leave it open another 10 more seconds. Okay. All right, we're going to close the poll and share. So there's no one here today as a person with a developmental disability. We have 23% here today as family members, 17% as coordinator of community services. That's also known as CCSs. DDA providers are represented with 40%, and 20% is other. So thank you again for participating in the polls. And now I'll turn it over to you, Marianne. Good afternoon.
Thank you, Donna. Oh, good afternoon. Thanks, Donna. Thanks so much. Well, first I'd like to say welcome on behalf of the Maryland Community of Practice for Supporting Families to our webinar today and this webinar series. The purpose of this series is to bring individuals with intellectual and developmental disabilities, families, and others together to connect and share information and ideas, all in an effort to support one another as we move through everyday life. We discuss and address a variety of topics and concerns both individuals and families face, right? And we do this with invited guests and subject matter experts, and always through the lens of Charting the Life course. For those of you who are unfamiliar with Charting the Life course, it is a set of universal principles and tools. Its fundamental principle states that all people have the right to live, love, learn, work, and play, and pursue their goals in their community. It was developed out of the University of Missouri, Kansas City's Institute for Human Development Family to Family program by people with intellectual and developmental disabilities and families. They created it to assist others to develop and create a vision for their own good life. Think about what they need to know and do, navigate and develop supports and resources, and finally just truly discover what it's going to take to live lives of their choosing and to be able to do it. At its core, Charting the Life course views the person within the context of family, however that's defined, and community, and the critical role that families play in the lives of their family members. Keeping both the individual and family in mind, the goal is to support the person to achieve self-determination, interdependence, productivity, integration, and belonging in all aspects of community life, and to support them to live their best life. With regard to families, we want to support families in ways that expand or build their strength and capacity and unique abilities to best nurture, love, and support all individuals to achieve and live their good life as well. Today, our focus is on transformational policy and systems change, which is one of the principles of Charting the Life course. This principle involves the necessity to make sure that all individuals and families are truly involved in policy making so that they may influence or impact planning, regulation, policy, practices, and or the revision or changing of any of these that might affect them. And at any level, you'll learn about how DDA will work with its new quality improvement organization, Liberty Healthcare, along with our community partners and you, hopefully, to build a framework or a way to improve both the quality of its supports and services and the ways in which they're provided. So it's pretty exciting. Most importantly, you'll learn about how you can play a role to improve our systems and support by sharing your experiences and informing us of what is and isn't working so that we can best serve you. So let's get started. Please join me in welcoming both Jennifer Metrick, who is the Executive Director with the Quality Improvement Organization with Liberty Healthcare. Jennifer, wave your hand a little, thanks. And then Ms. Nicole Kropfelder, who's the Director of Quality Enhancement with the Developmental Disability Administration. Nicole, little wave. Okay. So we're going to get started with Jennifer. Jennifer, can you please tell us about Liberty Healthcare as a QIO and how it's going to help DDA to improve the quality of its supports and services and the way in which they're provided?
I'd love to. Do we want to go to we can go to the next slide. Thank you. Thank you for having me. I really appreciate it. We're really excited to start this work with the department and really with the entire developmental disabilities community so that we are moving in a direction where we're supporting people to live the best life, their fulfilled lives, and within all of the principles of Charting the Life course. And we'll talk a little bit about how we can integrate those in the work. But in general terms, a QIO is an organization that includes health care experts, consumers, and coming together to be able to shape policy through data collection and evaluation. So as Marianne had mentioned, really looking at what's working well in the system and what isn't working, and where are those areas in which we would be able to potentially change policy or practice that are going to enhance outcomes for people supported by the system as well as their families. And so QIOs are here to provide technical assistance to states, so to really improve that person-centered service delivery. And so those are the components of a QIO, and we'll walk through that in a little bit more detail. So you can go to the next one. So you might be asking, how does a QIO, or how is Maryland's QIO going to impact the people that are being supported in the system? First and foremost, we want to hear from people and their families. We want people to have a voice at the table and make sure that we're understanding their voice, their experiences, if they're satisfied with services, what parts of services are working well for them, what part of services may not be. I just want to make sure, are you guys getting feedback, or okay.
No, you're fine.
Okay, great. I think it's just in my headset. The second area, so we will be providing opportunities for interviewing people. We'll also be doing evaluations of the system itself. So we'll be evaluating the case management aspect of our system. How are case management services being delivered to people? Are those services being done in a way that's consistent with how it's outlined in our waivers and in policy and regulation? How are actual services being provided to people, and how is that impacting their outcomes, whether it's their health outcomes or the goals that they're setting for themselves and reaching those goals? So it's looking at all aspects of the system to be able to discover those places where we have opportunities to improve and ultimately help to impact people's lives in a positive way. So once we collect a whole lot of evaluation data, then we're able to analyze that, and we'll actually be using the Charting the Life course framework to look at those different components in people's lives when we're looking at the data, to be able to say, are people being able in general to choose the services that they want? Are they able to change providers easily? Are they satisfied with the planning parts of their service or the actual service delivery that they're receiving? And we'll be able to look at the data within those components and those different life domains to be able to give feedback to the department on, here are some of those areas where we might be able to do additional training and education of providers or CCSs, how we can help make sure that family members are at the table as part of the planning process. Whatever those components are, we'll be able to kind of hone in on those and be able to provide the department some guidance and recommendation on ways that we can move forward to improve that experience and the services people are receiving. So you can go to the next one.
Okay. So for folks out there, I've had to mute, cut down on the feedback, but when I mute, I'm not able to move the slides forward. So I'm going to have to take us out and come back in again. So please just bear with me for just a moment.
I'm sorry.
No, that's not a problem. We'll just, we'll get to it. And then come back. From current slide. Okay.
All right, great.
Okay.
So there's several approaches that we're taking as Liberty Healthcare to make sure that the work of the QIO is really having the most impact possible on people that are receiving services as part of the system. So the most important component to that is ensuring that people are really at the center of their services, that they are decision makers, they're driving the supports that they're receiving within their family unit, and the people that they choose to be on their teams. So you'll see, as I've described moving forward, how we ensure that people will truly be at the center of their services, and part of the QIO activities. We'll also, I'll describe a little bit about our experience in terms of our Maryland team that comprises the QIO. I'll talk a little bit about collaboration efforts and what to expect as we move forward with this partnership between DDA and the QIO. And then we'll also talk about those components of building a culture of quality improvement, which is really important because we're never done this work, right? We are always trying to look for opportunities for those enhancements to improve the system. So you can go to the next one. All right. So as I was saying before, we really wanted to make sure that we were incorporating as kind of our foundation the concepts and the principles and those core life domains that are part of charting the life course. So we want to make sure that all aspects of the data that we're collecting and the information that we're analyzing and sharing with all stakeholders is focused on people's personal strengths and assets. It's focused on relationship building, technology, their community-based resources, as well as their eligibility-based resources, because we know it's all of those components that are very important to helping somebody live their best life, and so they really can be an integrated part within their communities. And so you'll see as we move forward, when we are providing data and what that looks like and trends over time, we will be using many of the domains and areas of charting the life course to be able to tell that story. And also the other large component is making sure that all parts of our evaluations involve hearing from people, being able to talk with people who are receiving services as well as families. And I'll talk a little bit later on specific ways we're going to be doing that. You can go to the next one. Thank you.
Mm-hmm.
So I have personally experience within Maryland. I've spent my entire career in Maryland. I started in the children's behavioral health space and working with states, or especially Maryland, but then also other states, to bring to states evidence-based practices for particularly for family services and behavioral health services for children and adolescents. And then I moved into the developmental disabilities community and have been a provider prior to this for the last 7 years. Our quality manager on the team also has 10+ years of experience within developmental disabilities. We have field-based team members that have been CCSs, that have worked with provider agencies and have done quality type work. We have also members of our team that have done quality work within the state system. So we have a lot of different vantage points of the system and that experience to really understand Maryland, where we're at right now and where we're trying to go. We also have partnered with People on the Go Maryland, and they have been helping us to recruit and also train advocate reviewers, so people with lived experience that have received services through DDA. They are part of our interviewing team, and we'll talk a little bit more about that for the National Core Indicator surveys. So we're really excited to have this diverse team that's going to bring that expertise to the work. And we can go on to, oh, great. So with collaboration is a core value at Liberty Healthcare. It's one of the cornerstones of the work that we do in multiple states. So we're in about 15 states. For our quality work, we're in 5 states, including the District of Columbia. And making sure that we are coming alongside all of the members of the DD community is critically important to this work. We want to make sure that we are able to hear from you and your thoughts, not only in the design of the evaluation tools, the data collection tools that we're creating, but then also the logistics of implementing those, the data that we're going to be providing back. We want to make sure that this is a transparent process from start to finish, and that there's opportunities along the way for stakeholders to provide feedback. One of the ways that we're doing that is we did create a collaborative work group, and this collaborative work group is made up of family members of people receiving services within the system. It also has self-advocates as part of that collaborative work group, providers, service providers, as well as CCS provider organizations, a few members of the Liberty team, as well as a few members of the DDA team as well. And so with that group, we're going to be looking at each of the main components of the different evaluations that Liberty has been asked to do as part of our contract with DDA. And we'll be looking at what are those key questions that we're trying to answer as part of these evaluations. Why are these evaluations important? There's a lot of different reasons why DDA needs this information to be able to enhance the system. And so we walk through that. We walk through the process in which our reviewers will be doing each of the data collection components. And that way we can get some really great feedback from all of those members of maybe aspects that we had not thought about that we need to include as part of collecting that data, so that we know that the data that we're collecting is information that's going to matter to people and to families and is going to have an impact in their lives. So that's really important that we're hearing from people. We'll also be sharing information on our QIO page of the DDA website. So as we are finalizing or close to finalizing tools, we'll be able to post some of that information and people can provide feedback from what we're posting on the website as well. So again, we're going to try to be as transparent as possible, have information shared in advance of us actually conducting those evaluations. We're going to be creating opportunities where we're going to pilot and practice doing the reviews before the data is actually released, so that we know, okay, is this working? Is this getting us the information that we need to answer the most critical questions? So those are some of the ways in which we're trying to build as much collaboration into the process as possible. We can go to the next one, great. And so I talked about the importance of building a culture of quality, and really everybody has a role in this process. And so whether it's providing feedback or responses to the information that's coming out, because data is, it's collected in a quantitative way in terms of this is what we're finding in this evaluation, but there's always a story behind the numbers, and we need to make sure that we're collecting those stories so that we really understand the data and we can use it in a way that's, again, going to enhance services and hopefully enhance people's lives. So it's important to have that context as part of it. We want to make sure that the data that we are collecting, and I think I've said this a couple of times, is really going to impact people. If it's just check the box, we did this, sometimes we have to have that type of compliance information, and we have to make sure that there's certain pieces in the system that are working the way they should. But at the end of the day, if we don't have the voice of the people receiving the services and their families, we won't really know if what we have in policy and practice is actually helping you in your day-to-day life. And that's the point of the system. And so we always have to be continually looking at that and making sure that we have that focus on, are we doing the right things that are having the greatest impact on people? And so that can evolve and change. There's also the rules evolve and change, and how we have to develop the system. What it looked like 30 years ago is not what it looks like today, or what it will look like in the next 30 years. We always have to keep pushing that needle to make sure that people really are living their best lives. We need to make sure also that we're using evidence-based methods. So we'll talk about a few of the data collection tools that we're bringing to this work that have over 30 years worth of data and evaluation work that's helped to validate that these are truly evidence-based ways to collect information from people. Because if it's bad data going into the evaluation, it's bad data coming out, it's not going to give us what we need to get better. And then we want to make sure that with a continuous quality improvement type of mindset, it's proactive, right? We're planning for the future. We're looking for those opportunities for improvement. It's less reactive. Sometimes we change things because something not so great happened and we need to rectify it. This is a way to look at trends so that we can get out ahead and make sure that we're improving quality before something negative happens in somebody's life. So that's the other aspect to this. All right, so we can go to the next one, and I'll start talking about, okay, so what is it that we'll be doing as part of the QIO? So we have contracted with DDA for 5 years, and over that time period, one of the goals of this work is to be able to help the state be able to acquire the Council for Quality and Leadership network accreditation. And so I'll talk a little bit more in detail in the next slides about what is network accreditation, but think about it as a way that we are continually improving the system so that we can say that we're reaching a level of person-centered excellence in our service delivery, so that we're pulling all of the best practices that are out there to be able to ensure that our service delivery system truly is person-centered, and we're setting ourselves up for success in that way. So I'll talk a little bit about what's going to be included as part of that. I'll also talk about how we're going to help the department look at how are we doing? Are we meeting the basic system standards? So the Centers for Medicare and Medicaid are who govern our 3 waivers in Maryland. And we create waiver applications and processes as part of that. And with those waivers, we have outlined all of the conditions. So whether that is the training requirements of providers and the people that are providing services, to the kinds of policies that providers need to follow to ensure health and welfare of waiver participants, or that they have a planning process in place and they're receiving that on at least an annual basis. All of those components that are requirements of the waiver will be helping the department with their performance measures. They have to report performance measures out to CMS on a regular basis to say, how well are they doing? How well is the system designed to meet those waiver assurances? And so some of our evaluation and our data collection efforts will help the department to be able to answer those performance measures and beyond, so that we really have that information on how well are we doing as part of the services being provided to people. We also will know that because we're going to be asking people and family through the National Core Indicator surveying, what has your experiences with services been like? What's been going well? What hasn't been going well? So we'll really get more at not just are we meeting those waiver standards, but how well are services being provided? That's really important. And then we're going to also be able to say, are people better off because of services? And so we can do that with the data that we're collecting through the Council for Quality and Leadership's personal outcome measure. This is one of those evidence-based tools that we'll be able to utilize and talk with people to really see, are your life outcomes being met? And if they're not, are supports in place, whether those are paid supports or non-paid supports, in place that are helping you to reach those outcomes, especially the outcomes that are most important to you as a person. So the personal outcome measure is going to be an incredible tool that we're launching across the state that's going to give us that information, because oftentimes we are focused on the compliance-based information and all the things that we have to do as part of the waiver and service delivery, but we don't always get to, okay, are we actually making a positive impact in people's lives? The personal outcome measure is going to help us do that. And so we'll talk a little bit more about that in the next slide. So on our journey, because it is a journey towards person-centered excellence in our work with CQL, they have been doing this work for 35 plus years. They've developed two really important tools, the personal outcome measure, as well as a basic assurance review. And that basic assurance review is a tool where you're making sure that providers have the right things in place, where they truly are providing person-centered practice. And it's a way to evaluate an organization's policies and procedures and seeing if that's really being delivered on a day-to-day basis through observation, and then also the interviews with people supported, which is through the personal outcome measure. So the personal outcome measure has 21 outcomes that it is gaining valuable insight into the person's life around. Through that tool, you're able to see what are the outcomes that are most important to people. You're also able to see if that is occurring in somebody's life, if that outcome is met in their life currently, are they working towards it, are supports in place that are helping them to reach that life outcome. And these are life outcomes that all of us have. These are human life outcomes that we all want in our lives, right? We want to feel safe and secure in the environments in which we live. We want to make sure that we have the best possible health. We want to make sure we have the opportunities to form relationships, meaningful relationships with people, that we have opportunities to work where we choose to work, live where we choose to live, participate in community activities in the way that we want to participate in community activities. So the personal outcome measure is getting at, are those things occurring for people? Are they met in their lives? And then again, the basic assurances is really looking at, are the right things in place within a provider organization that's going to help people to reach those personal outcomes. So that is the data collection work that we will be doing on behalf of the Council for the Quality of Leadership. And what we're going to see over time, because this is a 4 to 5 year process to try to reach a level of person-centered excellence to be accredited by CQL as a state. This is not accrediting individual organizations. There will be opportunities for organizations that they would like to do that individually, but this is a statewide accreditation. Do we have the right things in place that are supporting providers and CCS organizations to ensure this level of person-centered excellence? So that's the CQL work. As I had mentioned, we're also making sure that the waivers, the 3 waivers that are in place in Maryland, that they are operating as intended, and that we have all of the right components in place and people are receiving the supports that they need in a timely fashion, in the way that is outlined within the waiver. And so some of those areas in which we'll be doing evaluations include looking at the eligibility process. Are people receiving redeterminations, their level of care redeterminations in a timely way and in a complete way that's meeting standards? Are people receiving, are they able to participate in a person-centered planning process on at least an annual basis within the timeframes that are outlined within the waiver? Is the person-centered plan, did that process happen the way that it was intended, and it's connecting what's important to people and what's important for people into what's outlined in their person-centered plan and the services that they're selecting? Is there alignment there? Are we making sure that there's a health risk screening tool completed with somebody at least on an annual basis, or when there's major changes in their lives that would then warrant a new health risk screening tool? So we're looking at all those components. Is our process to ensure that people are free from abuse and neglect and exploitation, is that process working for people? Are we able to impact so that people, if they have experienced that, they're not experiencing it again? So is our incident reporting process working as it's intended? Do we have qualified providers in our system? We have a whole process for maintaining, whether it's through licensure, certification, that providers are meeting certain standards. This is a way to also do a more in-depth evaluation to verify that that's happening. And we'll be using the basic assurances through the Council for Quality Leadership to do that, to really help us set that standard and move towards it over time. And then, of course, we have to make sure too that we have financial accountability within the system, so that that we know that the services that have been paid for, that they were actually provided, and they were provided in a way that is in alignment with what is in the person's person-centered plan, with staff that are qualified at the time that they provided that service. So these are the types of evaluations that we'll be helping the department with. And then we can go to the next one. So the last main core component of the QIO is around helping the department with the National Core Indicator surveying in these 3 specific areas. So conducting the adult consumer survey. So these can be done in person and or remotely based on the choice of the person. They are going to be conducted by quality reviewers and advocate reviewers that are partnering up in interview teams to be able to survey and talk with the person, collect the information as they're trained to do so through those that operate the National Core Indicator Surveying, which is the Health Services Research Institute. So they receive training, they're actually in training today. And then they will be launching that survey in the next couple of weeks. So we'll be selecting a random sample of waiver participants, and then we will be contacting those waiver participants to see if they would like to participate in the survey. And I'll show you what you'll expect to see in the mail if you or your loved one or somebody that you support receives a postcard. I'll show that to you in a second. You'll know that they have been selected to participate, and then we can walk through that process, and they can either consent or decide not to participate, that it is a voluntary process. But I encourage everybody to support people, to have their voice heard. This is really important. We have not done the adult consumer survey in some time, and this is just going to be really valuable data to tell us how are things really going for people that are receiving services. We also have 2 unique family surveys that will be going out at the end of this week. And so that will be distributed to all family members that if you, one survey is designed for family members who lived with their adult age over 18 or over with developmental disabilities. So somebody that's receiving services as part of the 3 waivers, families will be receiving that survey. If your family member does not live with you, they may live independently or within a residential group home or a different setting, then you would be receiving the family guardian survey. And so similar surveys, similar types of information that we'll be collecting, but they are unique, but they will be going out at the same time. So please be on the lookout for those surveys. They will be coming to you in the next couple of weeks. And if you go to the next slide, I'll talk to you a little bit about what to look for. So here is what to look for in terms of the postcard for those, for the adult consumers. So waiver participants, people that are receiving services, if you are selected as part of the sample for the survey, then you will be receiving a postcard. So we're going to do this in batches so that we're able to be able to send this out, and then you'll know that you'll be getting a call within the next month or so to ask if you would like to participate in the survey. So we didn't want to send them all out all at once to everybody. We'll be doing this in groups. We'll interview people by quarter. So if you receive this postcard, a loved one receives this postcard, or someone you support, please encourage them to respond in terms of if a Liberty team member reaches out to them to talk with them about the survey. Just encourage them to listen, see if this is something that they would like to participate in. They can have somebody support them through the process. They can do the interview independently. They can choose whether or not they want people to come and interview them in person, or if they would like to do it more of a remote option like this. We will make it work for the participant, whatever they choose. So be on the lookout for that. And then if you go to the next one, for family members, because you should all the family members on this call should be receiving a survey within the next couple of weeks. When you receive this in the mail, please don't throw it away. You're going to have several options, really easy options to be able to respond to the survey. And so one of the great things that we've added this year is a QR code. So you're going to receive a letter. It's going to talk to you about what's in the survey. You would actually be able to take a picture of the QR code with your smart device. It could be a phone or iPad or anything like that, and it will take you to the link for the survey. So you don't have to type in anything. It makes it really easy, and you'll be able to go in, complete the survey. I think it takes probably about, give yourself 20 to 30 minutes. There's a lot of questions involved. There's a lot of great information that we'll be collecting as part of that. But it's really simple to do that. Now, if you don't have a smart device or you'd prefer not to do it that way, there'll be a link to the survey where you can type that link into a computer. Again, it'll take you right to the survey opening page, and you'd be able to complete the survey. And then we also have a paper option if you would prefer to do the survey pen and paper and turn that back in. And we'd be able to give you a return envelope to be able to do that free of charge. So multiple ways to participate, whatever your choice is. But I really encourage everybody, if you talk to other family members, please encourage them to share their experience and their voice as part of this survey. All right.
Jennifer, I want to thank you for all of this information and the work that you're doing. And I'm so excited for DDA and this partnership. As as a Maryland citizen, this is the only place I've ever lived, and we've raised our daughter here for almost 31 years. You know, we haven't always had the opportunity as family members to provide input in an effort to bring about change. So it's so exciting. And for family members that are there out in the audience, please, I encourage you to respond to these surveys, and CCSs, encourage your family members to do this. We are fortunate to have Nicole Kropfelder here to talk about data that we've collected in the past and how that might be used. But before we get to Nicole, first I want to apologize for the noise. I think everyone in our neighborhood is cutting their lawn today, so I apologize. But in addition, I don't think we mentioned in the beginning that we welcome all questions. And if you have questions, you can put them in the chat, the question box to the right of the screen. Please enter those questions there, and we'll take those at the end. And we look forward to them. So with that, I'm going to welcome Nicole to talk to us about some of the results we have found and collected in the past and how we've used that. Nicole?
Thank you. Good afternoon, everyone. As Marianne said, my name is Nicole Kropfelder. I am the DDA Statewide Director of Quality Enhancement. I want to thank you for inviting me to today's meeting to give a brief overview of how DDA utilizes the NCI survey results to enhance systems for participants and families. As some of you may remember, in 2021, DDA completed the Adult Family and Family Guardian surveys. Once those surveys are completed, Human Services Research Institute, also known as HRSI, releases a national NCI report of results and also a state-specific NCI report. DDA takes this national report and begins to examine how Maryland compares to other states in the 5 topic areas of information and planning, access and delivery of services and supports, choice, decision-making and control, involvement in the community, and satisfaction with services and supports. DDA uses this report and presents the information to our Quality Advisory Council, also known as the QAC. The QAC reviews reports and other documents and provides recommendations to DDA to develop, implement, and enhance the quality of DDA's service management system and its comprehensive quality management system. On this slide, I wanted to provide an example of the data that is presented to the QAC. This slide is related to choosing the participant's coordinator of community services, also known as CCS. Maryland falls within the average range, coming in slightly below the NCI average. 25% responded to choosing their own CCS. 25% did not choose their CCS, but know that they're able to change it if they wish. And 49% indicated they did not choose and are not aware that they're able to change if they wanted. So 49% did not choose and were not aware. So DDA's question to the council was, how can we educate participants and their families that they're able to choose and change their CCS? The council then discusses and brings back to the DDA any suggestions on how we can educate and empower participants and families to make their own CCS decision. I've also provided a link that will take you directly to all of the Maryland specific survey results from years prior and the NCI website if you wish to view. Next slide.
Next slide.
Yes, please.
Thanks.
Thanks. So what's Maryland's next steps related to NCI? In the future, DDA may include some data results into our performance measures that are reported to the Centers of Medicare and Medicaid Service, also known as CMS, on a quarterly basis. These performance measures show how well Maryland is meeting the federal assurances for each of the approved waiver programs of family supports, community supports, and community pathways waiver. DDA can also use NCI data to make policy changes, make strategic planning decisions, and enhance overall state-level systems. On this slide, I have provided a quick glimpse of California's NCI dashboard. This is DDA's goal for NCI. DDA hopes to be able to develop a more enhanced NCI survey communication to participants, families, CCS, and providers by creating an NCI dashboard. You will be able to navigate through each of the survey questions and see the results along with viewing the specific area, region in Maryland. But we need to hear from each of you. In August, I attended an NCI conference, and a quote that stuck with me was, "Every voice you don't hear is one less voice that needs to be heard." So please spread the word and complete the NCI surveys. This is one way we can make change and enhance systems for participants, families, CCSs, and providers. Marianne?
Great. Nicole, thank you. It's so helpful to see how this information is used and what we might be able to do as a system. And even for me as a family member, as I think about it, and if we're able to create this dashboard to be able to go in and see the data, it just is food for thought and encourages me to think about other ways and solutions we might offer or work together on. So fantastic. Thank you so much. With that, I'm going to give it back to Jennifer. Jennifer?
All right, so I just wanted to talk just very briefly because I want to make sure we have time for questions. In terms of what to expect from the QIO, we are working with DDA right now to develop many of the evaluation or data collection tools. We will, however, as I mentioned, we will be launching the National Core Indicator, both the in-person interviews with waiver participants and the family surveys this month. So family surveys are coming out in the next week or so, and then we followed by starting to create and reach out to people, send out the postcards to those that are selected to be part of the in-person interviews. We'll be reaching out to folks. Also, CCSs will be probably utilizing your support. If we can't connect with somebody, we'll be reaching out to their CCS to see if we can connect, to see if they would like to participate. So that's what's up for November. We're also starting to pilot some of our processes in November and December to get better information on are our data collection tools going to be of value, and do we have the right components in place? We're getting feedback. We started our collaborative work group in October. We meet each month on the third Thursday, so there'll be information that we'll be able to post after those meetings on our QIO page of the website. As we are launching information, we're going to try to have webinars and newsletters and opportunities to share information on what's coming next, as well as the guidance and how we'll be doing, conducting each of those evaluations will all be shared with the greater community. And then in the spring, we're really going to be starting most of the Council for Quality and Leadership Basic Assurance and Personal Outcome Measure data collection. So there's a lot going to be happening in the next 6 months to get all of these components launched and start really collecting a lot of valuable data. We can go to, I think, the last slide.
Yep.
Which is just what to expect. Again, I think I've mentioned a couple of times the QIO webpage on the DDA website, as well as the collaborative work group. The members of the collaborative work group are listed on the DDA website, so that if you want to reach out to potential representatives to make sure your voice is heard or get their learnings from the process and provide feedback, that would be wonderful. We'll also, again, we'll be piloting some of our tools. We'll be practicing interviews, particularly with the personal outcome measure. So there's going to be lots of opportunities for people to participate as we're developing all of this work. And then certainly when we're sharing the data, that story behind the numbers is going to be really important, because I think learning from people and families what that really means in real life is going to give us that context to what do the numbers actually mean.
Okay. Terrific. Jennifer, it doesn't appear that we have any questions. And again, I apologize for the noise. I want to, because we don't have any questions, first I'd like to thank you both, Jennifer and Nicole, for being here today, and what a terrific job you did. I'd also like to ask folks, we have 3 polls we'd like you to take. It won't take long. Donna, if you wouldn't mind, could you launch the first one, please?
Okay, so there's are you or the person you support receiving services through DDA? So there's 3 responses. About half have voted, so we'll give it a few more seconds. Okay, we're going to close the poll. And it looks like 73% said yes, 27% said no, and no one said I'm sure, not sure. Next poll. Were you satisfied with the webinar? About half have voted. Take a few more seconds. Okay, now we're going to close the poll. So 73% said they were satisfied, and 27% said they were greatly satisfied, and no one said not satisfied. We have one more.
That's it.
Depending on the topic, will you attend future webinars? Getting 63% have voted. So we're going to close the poll. So 98% said yes, and 2% said maybe. So that's all the polls. Thank you for participating.
So Donna, thank you for facilitating those polls. I just heard from Yamanja that we have a terrific question. So Yamanja, let's hear it.
Hi, everyone. Thank you. I'm going to go ahead and just ask the question. It's a really good one, and they're all good questions when they're asked, but want to make sure that we share this. It says, we've completed these type of surveys in the past. Other than what you've mentioned with the surveys, what specifically will you do to monitor and ensure what programs are doing, and if they are providing the services they say they provide?
Okay, I can take that. That's a great question.
Terrific.
So we'll be going in and doing what I call verifications of the waiver assurances, or the things that need to be in place to ensure that we have a quality system. And a couple of different areas to answer that question specifically. We'll be doing what's called utilization reviews, where we'll be looking at the service documentation of services that have been provided and paid for. So we're looking at those Medicaid claims that have been paid for services as part of any of the 3 waivers. We'll be looking at a random selection of that, and by participant, we would be looking to see, are the services that were provided on those dates of service, was the staff member that provided that service, were they qualified on the date of service? Did they have the right trainings in place and the right qualifications? Was what was documented about the service, did it align with the service description that they billed under? So we'll say for community development service, were the specifications that are outlined for how you provide community development service, was that outlined in the service note that the staff member provided that clearly shows that the person received community development service? They received it for the time that they were supposed to. It's in alignment with their needs and what they have outlined in their person-centered plan. So it's that check of making sure that people are actually receiving the services that the system is paying for. Also looking at other process, looking at provider qualifications, being able to go in the basic assurances through the Council for Quality and Leadership. The way that that review is done is on site. So it is a mix of observation, interviews with staff and people supported, as well as looking at policies and procedures of that organization to ensure that they have person-centered supports in place and that they are meeting the requirements that are outlined in the waiver. So those are just a few examples of how we'd be doing that.
So Jennifer, thank you so much for that. I got a few little comments that said, thank you for answering that. It seems like a lot of families are concerned about how your reviews are going to help ensure the follow-up and quality monitoring of services being provided to their loved ones. So thanks for taking the time to answer that. I don't see any additional questions, and I know we're wrapping up. So Marianne, I'm going to kick that back to you.
Thanks, Yamanja. And once again, I want to thank you, Jennifer and Nicole, for being here today and sharing this information with us. I also want to thank Yamanja for her support and Donna for hers as well. With that, I hope you all have a great day, but I also like to invite you to join us on December 14th at noon for our next webinar on Maryland's Technology Assistant Program. We'll have Lori Barong with us. It'll be a good one. So with that, thank you and have a wonderful day and a wonderful week. Take care. Bye-bye.
Thank you, everybody.